What's up, beautiful people? Another day, another study. I think the findings of this study were interesting, not because of the outcomes per se, the blood pressure and the blood glucose, but actually the way that they were able to induce significant behavioral change in a population that usually is very hard to change their behavior. If you're a clinician, you know that working with patients who are in their 60s, 70s, 80s, it's very, very hard to get them to change their behavior. It's hard to get anybody to change their behavior, but people, in my experience, tend to get a little bit more stubborn as they get older. However, this study was a three-arm intervention. It was looking at increasing movement. So one group, they had a behavioral intervention to get them to sit less throughout the day. The other group, they specifically targeted more sit to stand transitions. So just moving up and down more, postural change more throughout the day. And the other group was a healthy living control group. They got the same amount of coaching sessions, but it was more participant driven. They had a couple topics they met with coaches about just to serve as a control group. Now, the interesting thing to me in the study was that the interventions were successful. In the sit less group, they did decrease seated time per day by about 58 minutes per day compared to the control group. However, they didn't really increase their sit to stand transitions, but the sit to stand group increased their transitions by about 26 per day. And then they had a increase in about 6 minutes of moderate or vigorous physical activity per day compared to the control group. And the interventions were so successful at doing what they were targeted to do, there wasn't any bleed over or crossover effect. So the sit to stand group did not decrease their total seated time per day by a significant amount, and the sit less group did not increase their transitions per day. So that to me is the most interesting finding. Now, they did find that both groups did decrease systolic and diastolic blood pressure. Only the diastolic decrease in the sit to stand group was statistically significant. However, the numbers, and I put them down below, were clinically significant. A 2 millimeter per mercury decrease in systolic pressure can reduce cardiovascular events by 7 to 10%. Now, there are some caveats with this study. Nearly half the participants had hypertension. Many were on medications that may have blunted the overall effect. And it was a short trial. It was only 3 months. And there may be no more time needed for the glucose regulation effects to take place. But overall, this is adding to the overall body of literature showing that these targeted behavioral interventions do work and that more movement throughout the day is important for cardiovascular health.